Welcome everybody to today's video where I'm extremely grateful to have Nichole McIntosh and Xabi Cathala here today to talk about a fantastic initiative that they've set up to support student nurses called Student Nurses Talk. And I saw this online. I saw how you were supporting student nurses. I was really interested in this initiative, and I think that it would be really helpful for you to share your work. So I invited both of Nichole and Xabi on today. So thank you so much for offering your time.
Thank you for the invitation.
Okay, and also I'd like to acknowledge Calvin Moorley, who couldn't make it today. He's been a key part of this initiative as well. And I watched a fantastic YouTube video this morning with Calvin Moorley on, and he's facilitating a Student Nurses Talk international network event, and that's on London Southbank University YouTube channel. So go and have a look. And he's running a themed discussion, so it's really helpful to see the practical application as well. So I hope lots of you out there, if you're educators, can learn from this talk today. So I thought we'd start with Nichole and Xabi. If you just tell us what your current role is and a little bit about your career to date, if we start there. So if we start with Nichole.
Yeah, thanks, Carol. My name is Nichole McIntosh, and I'm the Regional Head of Nursing and Midwifery in the Workforce Training and Education Directorate at NHS London. And I am leading a team of nurses, midwives, and other practitioners, as well as program staff, to ensure that we have learners who are having a positive quality learning experience, and we retain and recruit people from our local area more. So my work covers quite a few work streams, and thinking of how we can ensure that we are inclusive and have a very diverse learner population that reflects the diversity in London. Thank you.
Thank you, Nichole. So Xabi, do you want to?
Thank you, Carol. My name is Xabi Cathala. I am the Deputy Head of Nursing for ID Nursing at City St George's University. Background, I am a nurse. I am an IT nurse, so intensive unit care nurse. As you can hear, I'm from France, so I've done all my training back home in France, and I moved to the UK about 9 years ago, where I had kind of like relearn a little bit nursing because it's different practices. So mainly ITU, but I've also worked as a district nurse, wards, surgery, medical wards, and so on. And I moved to the university settings about 5 or 6 years ago now, which I'm enjoying it greatly. So yeah, it's really supporting students is quite something very important for me. So I'm very glad that I got that position now, that I can have an impact on students' progressions and journey.
Thank you so much. And your students are so lucky to have you both because you're an amazing support. So, so first of all, I'm going to start with Nichole, and it'd be really helpful to know where the idea initially came from for Students Nurse Talk.
Thank you. So, during the pandemic, COVID-19 pandemic, we had reports of staff feeling that they weren't able to give the care that they wanted to give, and a term called moral injury came up, where people, you felt guilty. And, students as well, learners were in that position where they were in situations sometimes that they weren't able to feel seen and feel heard. And we thought, actually, we need to have a psychologically safe space online, because it was in the pandemic, we were socially isolating, where we can have honest conversations where learners would be invited to come and to share in a safe space. It was important for their health and well-being that they felt that whatever they said, and they knew whatever they said there was safe. But then if they needed help, that help was nearby. So we made sure that we only share the recording. We had these meetings once a month. We shared it on social media, and we ensured that we started out by sharing as leaders, me, Xabi, and Calvin, how we were feeling. And that was role modeling good behavior in terms of if we were having a tough time, we would say it. because there is strength in vulnerability, and we wanted to ensure that the learners felt that they were refreshed and ready to go back out. Using the terminology of the army and the military terminology, where we were talking about frontline, frontline staff being on the front line. It was important for students to be able to take off the armor for that 1 hour and to just relax for a bit. And it took the form of a thematic approach each month following the student journey. So in September, it would be about how do you ensure that you're able to write at an high academic standard, just getting them mentally prepared for the journey ahead. In October, we would have Black History Month and would invite people in based on the topics. In June, we talked about pride and ensuring that everyone felt seen and heard, and that their lens through which they were taking on this journey in a pandemic, that they needed to be celebrated, because as practitioners with years of experience, we were in awe of their resilience, their ability to just be agile and to work with whatever was happening. And we kept saying to them that they were the COVID generation and they should wear it with pride rather than be seen that I'm missing out and things have changed. So we did it. We had a year's program planned, but it was important that it was online, psychologically safe, and that we would share, but we would be able to stop talking as leaders. And if there was silence, not to be too quick to break the silence. Because, the first time we did it, we had to fill the gap. But then you realize sometimes the silence speaks volumes, you hear, and then when you allow the chat and you react to the chat, so someone puts something in the chat and someone else says, but I've had that, oh my goodness, I'm glad you said it. And you could see people are feeling safe. So it took a while, but as facilitators, it wasn't about our egos. It wasn't about us showcasing how wonderful we are and accomplished. It was none of that. It was about putting the students at the very top.
Yeah.
And reminding them that we care, and that as leaders, we are able to be kind and comforting and nurturing, but challenging at the same time. So it wasn't a case where we just took on people's problems. We were able to say, so what are you going to do? So it was coaching, it was mentoring. It was a wonderful experience. And I think if I had to do it again, I definitely would. Working with Xabi, I said I was the rose between two thorns, or was it the thorn between two roses? I can't remember which one I said, but it was a good team to be working with to facilitate it at that time, and students still talk about it now.
Amazing. And I think that's what really struck me, Nichole, is having that, when I emailed you, is having that safe environment where they can voice and talk, openly, because they have such challenging environments to.
Sorry to disrupt, but I have someone at my door, so I don't know if we need to pause or edit out this.
Oh no, carry on. No, it's fine, because what I'll do is
I just need to go.
That's okay. I'll ask Xabi the next question, so we'll keep going. So don't worry, not a problem at all. So so that's what struck me about being really, that you're giving students that voice. So Xabi, I think what will be really helpful for people out there is to know how it was sort of structured, the sort of process of setting up a little bit more detail of, how often you ran them and how did you go about formatting the process sort of behind it would be helpful for other educators, if that's okay.
So when the idea came up, we met with Calvin and Nichole to see how we're going to do that, how we're going to make this happening, to make sure there is a positive impact and to make sure that students get what they needed. So the first thought, it was, okay, that we have to be online, because then it helps to reach more people and have a wider participation, that face-to-face. So we decided to put it online, but then we look at how often we're going to do it, what kind of theme we're going to talk about, how we're going to structure those sessions. So Calvin and I are from academia, so we are working at university. So what we try to do is to try to map a little bit their journey of the university with the big different themes that they have
Yeah.
through the year. So like Nichole said, around December, we were talking about assignment because we know in January they have all the assessment weeks and all the assessment essay and exams, so we could support them to prep. June, we're doing the Pride Month, so we're talking about EDI, and all those values are very important for nursing. So we try to have themes through the year that match up with their journey at university as well and in practice. Then we've done it once a month, to having enough time between sessions as well, but not too long, to make sure we meet with students regularly. And it was in the evening, that making sure that they can come after the university or after a shift. So it was not in the middle of the day; it was toward the end of the day. And the sessions on itself were structured the same way each time. So Calvin was sharing the sessions, and we were co-sharing with Nichole. And then usually we had a speaker related to the theme of the sessions. But the speaker, we have about like 10 or 15 minutes, which what we try to condense that a little bit to make sure students had enough time to be able to discuss their needs and the issue, their question, their queries, because that session, we really wanted it to be student-centered.
Yeah.
What is important is the students and what is about the students. So we were trying to give as much space as possible to the students, but also trying to use our links and network that we have now after years of work for students to be able to connect with people that might not be able to connect if not, and have those discussions and all that experience that those speakers have. And that was really nice to have, because then students can feel that it's not because you're a leader, it's not because you're a professor, it's not because you are a director or something that you're not approachable, that you can't talk with, you can't have a conversation, and you can't learn from them. We are all approachable, and we're here to help students and nurses. And I think that skills of being able to discuss about topics with people that may be seen as senior people, leaders, may be a bit sometimes scary. And actually, when you get used to that sessions and how you do things, that breaks a bit the wall, and then you have a much more, how can I say that, direct conversation, but in safety. So we have learned so much from that, and from feedback from students, they've been able to discuss and put on the tables topics that they didn't have the chance to do before. So that's how we try to kind of like structure it. Obviously, there is LSB has been really good at supporting this event, because they were organizing it. There is a lot of people behind the scene to create the sessions, make sure keep them track, getting the links out on social media to be able to reach students nationwide. And we even have international students joining us as well at some point. So there is got a lot of behind the scene that is going on. And NSB has been really helpful with that. So yeah, that's how we structure it.
Yeah. Brilliant. And so that's very helpful for other educators to know. And I love the fact it's student centered, and but that you do that little bit at the beginning, you know, and you can network signpost students as well, which is fantastic. I mean, just one additional question is, because it's all online, and in relation to, was there any issues with doing it online, or anything you had to do with preparation with students beforehand, or anything sort of linked to that with preparation, or was it, or did it all go okay with online? Did you just do it on MS Teams or Zoom, or yeah, so it was
MS
just
Team. We used MS Team, and we were using the same link every time. So once you got the link, is the same link, and they know they just click on that link and they join us. We didn't have much issue with the online or the connections or these kind of things, especially that now students are extremely aware about MS Team and online sessions and online teaching. But now it is getting in the normal day-to-day basis, really. So no, we did not have issues with that. No.
So it's really helpful to hear about the process of setting it up. And I'm going to go to Nichole now and just ask, what impact do you think that this initiative has had for your students? And I'm sure it has had positive
Yes,
impact, but from
yes,
your perspective, what?
it it has shown that we care, and I think that's very important. You can't just say you care, you have to show, and it really did show that we cared because it was done out of hours, and we made sure that we didn't rush it. So if the conversation needed to be extended a little bit, we were flexible. It definitely amplified the student voice and the students' place in healthcare and putting the students at the very top. So we started out each session with a statement about the South Bank University's inclusivity, and by staying here, this is what we expect, behaviors, these are ground rules. And we did honor everything we heard from the students. So students, after a while, they wouldn't miss any sessions because they know that if they say it here, something got done. So if it was to take a conversation off and give some support in the background or follow up with an email or share some resources, share links to other areas of support, we did that. I think it helped to dismantle the hierarchy in terms of positional power. As Xabi said, it's like, oh, I'm very important and I speak more than you, so you listen. None of that. It was really quite positively disruptive and deliberately so. So I think we were able to have some conversations that were hard-hitting topics, hard-hitting: equality, diversity and inclusion, racism, discrimination, feeling invisible, feeling judged, feeling othered, but we did it through a very kind, compassionate, empathetic, human to human conversation where a student would put something in the chat, and actually we weren't shy in saying, that was very courageous and brave, and we salute you for doing that. So we encourage boldness and braveness. I think it showed, as I said, good role modeling as leaders, because what we want is for students to remember how impactful it was for them to have that. And when they become leaders, not to just forget. And we talk about sending the lift back down, in other countries, we call it an elevator, but it's important that we lift as we rise. So we were, in effect, some of the students, you could spot leadership potential quite quickly, because I reflected that I would not have been able to be as articulate as some of these students. And we were able to say, actually, you definitely are someone, who has leadership potential, and be very bold in saying it, because you plant a seed. You plant a seed. And I told the story, I think I told the story of, as a student nurse, someone saying, Nichole, there's a ladder under you. And I thought that was, as a Jamaican in England, I thought that was an insult. But then I reflected over the years. It's important when you spot leaders, talented people, that you tell them, because they might not have heard it before. And they might be thinking, are you talking to me? Are you sure? But it's important.
Yeah.
It's important to say it, because it really boosts your confidence. And at a time when you're struggling with assignments and all of that, to hear a leader, a current leader, saying to you, you have potential, keep going, that really did help. And some students contacted me, because we always give an open invitation for people to contact, and they did. They made, we call it virtual coffee chat. So I would ask my assistant Elvis to book someone in if they contacted me, and we would have a chat. And some of the times it was just them saying, I really was feeling a bit down before the talk, and after the event, I felt so encouraged that I just wanted to tell you. It was something simple as that. And it really did remind us of our why. Remember, in the pandemic, it was fast moving, it was fast paced. So this was our way of refreshing ourselves as well, to remember our why, so that we didn't just get caught up being busy doing the business, but remembering to take time to care for others and for ourselves. So it was an experience, and even the guest speakers who we invited in specifically would want to come back, and we would say, yes, you are welcome to come back. So yes, the impact is still being felt. And I think definitely the amplification of the student voice, we didn't give them a voice because they already have a voice. So we never talk about giving students a voice, because that implies that they don't, but they currently have a voice. But sometimes in the noise of the world, we just needed to help them to amplify, to give them the skills in their toolbox, so that when they were back on placement and they were faced with a mentor who maybe was not doing what they were supposed to be doing, that they were empowered and enabled and equipped to navigate that when we weren't around. So it was really helping them along the way to give them some skills and for them to use it in an authentic way that works for them. So it wasn't prescriptive.
Wonderful. So, I mean, reflecting on what you're saying as well as you're talking, Nichole, I think what comes across to me is the people running this, Calvin, Nichole and Xabi, but all three of you are very open. You're very student-centered. You're compassionate, kind people. That's what comes across. So to me, it's almost having the right people to run these events as well, because it can go horribly wrong if you're not that sort of. And to me, that's what comes across, that you are all special people. You're all very student-centered. You're all role models, but also you've got a lot of experience and skills between the three of you that you can signpost, and you know that you picked up the leadership skills. I mean, that takes experience, knowledge, and a certain person, Nichole, to be able to do that. And you know, you're obviously all three of you very student-centered, and I love the team approach. You know that you've used this team approach to create something really wonderful. And you're able to signpost. You have to have the knowledge to be able to signpost as well.
I think so. Facilitators of this have to be altruistic. It has to be about no ego. It cannot be about, look what I'm doing and I'm so wonderful to give you my time. It's the complete opposite of that. I think if you're going to facilitate this, you need to check your egos aside. You need to come to it with vulnerability, curiosity, and kindness, and to listen, to empathize, to understand rather than to judge. So if a student says, I'm struggling with the assignment, I've failed 2 assignments, you don't say, oh, you should know it by now. It's like, so what can we do to support you? You really have to be a critical friend, but in a kind way. So I think, there is a danger that in the wrong hands, it could be mismanaged. And students could end up leaving it feeling that, oh gosh, there's no point, because they're also wonderful and they don't seem to be able to tell me anything that they need to work on, and they're all perfect. I'm useless. So that is a danger. So you have to be able to share little nuggets about what you've been through, so they understand that you do understand discrimination. I do understand racism. I do understand misogyny, but I haven't allowed it to destroy me. And that takes time.
Thank you, Nichole. So Xabi, do you want to say anything?
I just wanted to, because I was just to try to give an example, and Nichole just alluded to it about the assessment. And we are in a society today where perfection is what you want, and then you need to excel in everything you do, and failure is something that is kind of shameful, or you're ashamed because you failed something. And in the students, where I failed this, I failed that, or I'm struggling with placement, I'm struggling with this. And I think having Nichole, Calvin, and I there and say, yeah, that is normal. I have failed assessment. I have set OSCE. I have struggled in placement. And hearing lecturers, senior lecturers, leaders, professors saying like, that has happened to me, I think for students is very important, because they have like a mystified vision of leaders and professors and lecturers where we're not failing, or we are passing everything, or everything is easy for us. And it's not. We are exactly in the same position than the student, and we've lived the similar experience that students have lived. And then to say it reassures them that, oh, actually, so that's normal. Yes, so that's why you need to make sure you know where the support is, how to access support, contact us. You can do this, you can do that. That is a kind of like a tip that you could do that way, and opening, and that helps students to be reassured that actually they are doing very well. If they are
Yeah.
struggling, it's normal because it's hard, it is difficult, and
Mm.
we had difficulties as well. It's not because we are in those high positions that we had it easy. No, no, no. We had also had difficulty. We failed things. It's not the end of the world. Actually, when you fail, you learn more, and it's
Yeah.
normal.
Yeah.
It's fun. There's no problem with that, and that is reassuring students, like saying like, okay, so I am actually doing okay. I just need to keep going and pushing and pushing. Now I will be all right.
Yeah. Yeah, 'cause it's devastating when you fail, and it's that reassurance is that positive reassurance is so important, isn't it? To Xabi, Nichole, you've got yeah,
Yes, I really agree with everything Shabby has
yeah.
just said. We shared different. I'm someone who studies a lot about Black history leaders, and I shared quite a bit about Nelson Mandela. And on the topic of losing, he said he never lost; he either won or he learned. And that reframing the concept of losing into learning, as Shabby said, it builds character. It shows what you have inside. And another thing that we shared with them was another quote from Nelson Mandela where he says, "May your choices reflect your hopes and not your fears." So we were in a time where it was
Oh,
scary. We're in the unknown. And we just kind of, and students were stopping programs, different things were happening. And we were just saying, may your choices reflect your hopes and not your fears. And that kind of just reminds them of someone like Nelson Mandela and what he's been through and us passing it on. But yeah, reframing that concept of losing, that I must get 100%. No, actually, you know what? A 60 on
yeah,
that assignment, I'll run with that. That's
yeah,
fine.
yeah.
And then developing, leaving the call with a plan. So it's not just giving them false hope. Is so what you're going to do? Oh yes, I'm going to get in touch with the librarian. I'm going to do this. We even got some. We got a librarian there at one point to come and give them some
Amazing.
tips. It was wonderful. Some practical tips, about how to do the searching, how to do different things, and different
Yeah,
ways around different things. It was wonderful. So we,
amazing.
we we looked at it from several different angles, and we made it fun. We
Yeah.
tried to make it fun. It was hard going. There were some calls when you left and you were in tears, but there were
Oh.
some calls where you left and you were just happy. So we dealt with a range of emotions.
And it sounds like you learned so much as lecturers and in your role as educators as well. And just thinking about that, reflecting on the whole project and what you learned, is there anything because you've obviously learned so much in relation to the whole initiative, but what is there anything you would do different? Lots of positives that you've talked about, but is there anything that you would do different or any um key tips or anything from what you've learned that you want to share with? Do you want to say Nichole first, if we start with you, if there's anything? I
Yeah,
know Xavi's got to go as well soon. So.
yes. I learned that actually creating a safe space from the beginning is really important, that people
Yeah,
know that it's safe and that there is integrity and confidentiality will be maintained. Really important for people
yeah,
to open up. So without that, you're going to have a very quiet call.
yeah,
um, Time and space. So making sure that we get the themes right and making sure it's mapped out, and that where we have to make changes, we do it flexibly. I think doing differently, maybe we could consider a combination now that we're out of the pandemic, having some face-to-face, some online. The online, you capture people all over the country. Even in America, we had links with some students in America. But the face-to-face, I think now that we're in the reset and recovery phase, maybe introducing some quarterly face-to-face ones would be something we could do differently. That's what I would say, Shabby.
Yes, maybe some hybrid to give the opportunity to people to meet face to face. Especially if we do, for example, in London, then they might see each other in hospital or something, and straight away you make links or you start having conversation. So that might help, and maybe also um, meeting face to face. The speakers might help as well when they go out working and so on. I think what I've learned from that experience is that our students are extremely resilient. They have a lot going on in their lives, and they still keep going even if it's difficult. They when at university, sometimes you go students will have a lower attendance, or they have some issues doing some of the things. And what I've learned is remind me every time I contact a student, you do not know the story or the history behind it. Come with a blank sheet, come with a blank page, listen to what is happening before even saying any tips or any things or any actions. So you need to understand what is happening for that students, and then you can support them. But the first things you need to do first is listening and hearing the students. Then you can advise and support. Um, I would like that those talks keep going and we can support even more. We've done a conference as well at the end of the year, which has been a real success, and they really enjoyed it. And again, that was probably something I would like to repeat, because I think that was really really good that we opened the conference to students like this. Um, I think it was really a nice experience. Maybe something in the future, maybe trying to integrate a little bit more students, maybe are co-hosting it with us or something like that, to have a bit more of a view, or from the students' point of view, we got already that experience or just completed their degree, then they can
Yeah,
help students and really give back feedback or something that is very fresh, because we've done it. We've
yeah,
been in university, but
yeah,
it's a while ago now. So even if I am on the other side of the university, but I am not a nursing student now. So maybe someone that's just done it or doing it could be quite nice to have as a co-host, or someone that is helping us.
yeah. Thank you so much. And I know you've got to go. I just wanted
Yes.
to ask both of you. I'm going to start with Xabi in case you do need to go quickly. I don't know how quick, but I always ask the speakers to give one key tip for a pre-registration student or somebody that might be struggling out there. Um, so,
So just one.
or one or two or three, I don't mind.
So I think the most important when you do your scan of study, because we very often forget that nursing study, it's extremely hard, because you don't only need to learn academic skills and thinking, you also need to learn an entire profession and skills. So it is, for me, it's kind of like double work. And I think one of the most important things is to know your ally, know who is your support. You don't need lots of people as a support. Maybe one, maybe two, maybe three, depends. And by knowing that person that you can go and then you can get advice from, you can get support, you can have that direct communication with when things aren't going well, when things are not going well, then you have someone to refer to and get a support. The environment again around you, a small environment but strong, to support each other and then just go through that journey. I think that is very important in nursing, because is also what's going to happen after, when you're going to start working and you're part of the team. When you're part of the team, you are in that team and you're all together to go through your shifts and have supporting student patients. I think it's the same kind of thing you need to have at university, to have that support in place.
Yeah, really wise and really helpful advice, Shabby. So, Nichole, have you got any
Yes, thank
tips?
you. I think I agree with all of that. And I think, in terms of the overall journey is to encourage our students to ask questions, to feel safe to ask questions and not assume. So, that's important. Knowing when to take a break, knowing when you're really tired, you're stressed, you're exhausted, being emotionally intelligent enough to be resilient. And I
Yeah,
keep saying resilience is knowing when to take a break, not going until you break. So that is really important to know.
yeah,
And the last thing is to just keep a journal of their progress. Because there'll be days when you think that you're not learning, but when you look at the journal as to where you started and where you are now, it will give you the motivation and the inspiration to continue.
lovely. So, I just want to thank you both so much because you're so inspiring, and thank you for everything you're doing for nursing and for students as well. And I'm really grateful for your support today. And I'm sure lots of educators will be really interested in your project and student nurses talk. So, thank you very much.
Thank you for doing this as
Thank you
well,
very
because you're
much.
making a really significant contribution. So thank you.
Oh,
Thank you
thank
so
you.
much.